Ladies and gentlemen, thank you for standing by and welcome to the NCD Alliance webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Wednesday, September 9th, 2016. I would now like to turn the call over to Katie Dane, Director of the NCD Alliance. Please go ahead.
Thanks very much. Good morning or good afternoon, everybody, and apologies for starting this NCD Alliance webinar a little bit late. And thank you for joining us today. So we have a busy agenda for you today, various different updates from different parts of the world. The agenda will include an update on from the United Nations, so from the New York side of things, from Priya Kanayson from the NCD Alliance. Priya will be talking you through preparations for the UN General Assembly and an update on the indicator process for the Sustainable Development Goals. That will be followed by an overview of where we are up to with the WHO Regional Committee meetings. And we'll have Jessica Beagley from the NCD Alliance, as well as Joseph Mucumbitsi from the East Africa NCD Alliance to be talking through the WHO Africa Regional Committee meeting specifically. The third agenda item will be around an update on the WHO Global Coordination Mechanism for NCDs. And this update will be given to you by Terrell from the American Academy of Pediatrics and the NCD Child on behalf of John Klein. And Terrell will be focusing specifically on the GCM working groups that have been set up for 2016. This will then be followed by an update on two regional activities going on. So the first one will be on the EMRO Capacity Development Workshop that the NCD Alliance just partnered with WHO EMRO on, followed by an update on an upcoming meeting, the Africa Regional Civil Society meeting. Both of them will be given to you by Cristina Parsons Perez, the NCD Alliance Capacity Development Director. And then finally, we'll be circling back to Geneva for an update on the WHO Appendix 3 process, which is that priority set of interventions for NCDs that has been being reviewed and updated over the last few months, and that will be by Alena Matzke from the NCD Alliance. So with no further ado, let me pass over to Priya for our first update on the United Nations. Priya.
Thanks very much, Katie. So as Katie said, I will go over preparations for the upcoming UN General Assembly and provide a brief update on the indicator process. So the overall theme of the high-level general debate is the Sustainable Development Goals, a universal push to transform our world, and that will be the focus of statements made by heads of state, government, and ministers in attendance at UNGA. As you can see from the official schedule, the 71st session technically opens on Tuesday, the 13th of September, but the high-level week and the general debate opens the following Tuesday on the 20th of September. There are two high-level meetings during this week that will definitely set the tone for many of the discussions, one on the movement of refugees and migrants, and the other on the issue of antimicrobial resistance. Next slide, please. And so this slide provides a quick overview of the high-level meetings being held during UNGA and outlines a bit of the program and expected outcomes for each meeting. During the high-level summit for refugees and migrants, there will be keynote speakers, a plenary session, and 6 roundtables. And this is held on the first day during the high-level week on the 19th of September. And these roundtables will have the following themes of addressing the root causes of large movements of refugees, addressing drivers of migration, international action and cooperation, and discussing the Global Compact for Responsibility Sharing for Refugees and Respect for International Law, a Global Compact for Safe, Regular, and Orderly Migration and Achieving Full Respect for Human Rights, and finally addressing vulnerabilities of refugees and migrants on their journeys. In addition to an agreed declaration, the outcome of this summit is to include a resolution on the agreement of the relationship between the United Nations and the International Organization for Migration. As a complement to the high-level summit, President Obama will host a Leaders Summit on Refugees on Tuesday, the 20th of September. This is co-hosted with a few other countries listed there on the slide. And this is really meant to appeal to governments to pledge meaningful commitments to address the issue of refugees and migrants. And finally, on Wednesday, September 21st, there will be a high-level meeting on antimicrobial resistance. And this meeting will consist of a plenary session and 2 panel sessions on the relevance of addressing AMR, antimicrobial resistance, for the achievement of the SDGs, particularly the health-related SDGs, and addressing the multisectoral implications and implementation challenges of AMR in a comprehensive manner. And you can read more about each meeting using the links provided, and it includes information about attending the meetings if you are in New York. And if not, all of these sessions, except the Leaders Summit on Tuesday, will be webcast on the main UN webcast page. Next slide, please. So moving into some of our key advocacy messages for the high-level week, which we hope will be of use in your own advocacy as you speak with others. Of course, integrated implementation across the SDGs is essential for achieving the NCD-related targets and health-related targets, and includes action on climate change, meaningful engagement in civil society, ensuring access to essential medicines and technologies for NCDs within the broader context of universal health coverage and health system strengthening, addressing NCDs in fragile and conflict situations, ensuring continued official development assistance, ODA, and increase of domestic resources for health, and finally, strong accountability mechanisms and reporting on progress towards achieving the SDGs. For more detailed information on our advocacy priorities, I encourage you to read the advocacy brief, which is linked at the bottom of the page. Next slide, please. So moving right along, our main side event during UNGA will be held on Tuesday, the 20th of September from 6 to 7:30 p.m. at Convene Center. And it will focus on leveraging solutions to improve access to health care for people living with NCDs. So the event will examine the different dimensions of access to care for NCDs in the context of health system strengthening, and include case studies exemplifying structural gaps and associated barriers. As you can see, there are more objectives listed there. And invitations have been sent, and if you've not received one, I strongly encourage you to RSVP using the link on the page. Next slide, please. So these next 2 slides will give an overview of some of the other NCD and health-related side events taking place during UNGA. This is, of course, not a full list, and we encourage you to view our full list of UNGA side events posted on our website. And, of course, if you find something is missing of an event that you are aware of, please do send us the details and we'll include it in the calendar. So starting on Sunday, the 18th of September, there are events on the Global Strategy for Women, Children, Newborns, and Adolescent Health, and an event on involving youth voices in policies for improving adolescent health. Tuesday has a focus on nutrition, that's the 20th of September, with an event on the UN Decade of Action on Nutrition, and an event in the afternoon on urban food systems and the challenge for nutrition. Wednesday morning, there's an event on public-private partnerships to address antimicrobial resistance, and that one is invitation only. If you are interested in anything that's invitation only, we're happy to provide the contact details for that. Next slide, please. So moving right along to Thursday, there are several events that are NCD and health related, including another event on nutrition, main WHO event on NCDs at 1:15, which will focus on supporting the UN Interagency Task Force on NCDs to achieve the NCD-related SDGs. One thing to note for many of the events held inside UNHQ is that room assignments are still being finalized, so that we will update our calendar accordingly once this information is available. And finally, on Friday, there will be a meeting for the Health and Post-2015 NGO group to discuss strategies for joint advocacy moving forward. Please note this is for NGOs only, and invitations will be sent by the end of this week. And a brief important note about passes for NGOs and civil society during the General Assembly. Access to the United Nations during UNGA is rather restricted due to the large number of high-level events and increased security. So for those NGOs who are in consultative status and have existing grounds passes, those will not be enough to enter the UN during UNGA, and no temporary passes will be approved for NGO representatives. Instead, if you are attending a side event that is inside UNHQ, you will need a special pass for that event, which will be issued by the event organizers. And also special passes will be distributed by the NGO branch on a first-come, first-served basis from 9 to 10 a.m. and 2 to 3 p.m. every day, right outside the visitors' entrance on 2nd Avenue, so 46th Street and 2nd Avenue. And we'll provide this information in writing on our website as well. The usual procedures for grounds passes and entering the UN will be reinstated after the closing of the high-level week on the 3rd of October. Next slide, please. So finally, I'd like to provide a brief update on the process to develop an indicator framework for the SDGs. The Interagency Expert Group on the SDGs, IAEG, will hold its 4th meeting this October in Addis Ababa. And this meeting is a bit different from previous ones in that there will be a 2-day members-only meeting prior to the opening plenary session where stakeholders are invited to attend. So this members-only meeting will be on the 18th and 19th of October and will then move into the open plenary session on the 20th and 21st of October. So as you can see, the objectives of the meeting are to finalize the tier system for indicators, establish a refinement process for indicators that need further work, such as indicator 3.8.2 on financial risk protection under UHC, to review work plans for tier 3 indicators, discuss options for indicators with a proposed custodian agency, and that means that health-related indicators will be under the review of health agencies such as WHO. They will also review data flows between levels, national, regional, global, and discuss best practices for data delivery. More information on the meeting and how you can register to attend can be found by following the link there at the top of the page. Next slide, please. And that is it for me, and I'm very happy to address any questions that might have come up.
Thanks very much, Priya, for that really comprehensive presentation. So do you think, we haven't got any questions at the moment, but just a couple from my side. You obviously started off by outlining the kind of high-level summits and meetings that are happening around the sidelines or the beginning of the UN General Assembly, and obviously none of them directly relate to NCDs. But it sounds like from what you're saying, obviously the calendar of events of the UNGA, as always, is packed with health-related events and NCD-related events. So it's obviously still an important milestone for the NCD community from your perspective.
Yes, definitely. And I think, the high-level meetings, while they may not directly relate to NCDs, I think there is that connection to NCDs specifically. If you're talking about NCDs for people in fragile and conflict situations, access to care for people living with NCDs who are refugees that do not have access to their normal health care systems. So I think there is that link to be made. And also in terms of antimicrobial resistance, some info there, some connections there as well. So definitely there are those links to be made, and I think it's important for the NCD community to come together, again, and broader health community to come together during UNGA to continue the momentum from the Sustainable Development Summit in 2015 when the SDGs were adopted, especially since we expect Goal 3 on health to be reviewed during the high-level political forum next July in New York. And so I think continued reminders to heads of state and heads of government that NCDs are an essential component of achieving sustainable development will help really drive that message home and make sure that those targets are reviewed during the HLPS.
Great, thanks, Priya. And just to clarify, obviously we know that the high-level political forum, which takes place in July, will be the official kind of review mechanism for the Sustainable Development Goals. Is there any link between the high-level political forum and the UN General Assembly?
Is there any what, sorry?
Any link?
Yes, definitely. So I think the high-level political forum, again, is the opportunity for governments and countries to demonstrate their progress and some of the challenges as well towards achieving the SDGs. And that moves into, again, the UN General Assembly for this year. The theme of is a universal push towards achieving the SDGs. I think all of those are related, and the UNGA gives us a broader overview of what heads of state and government are thinking in terms of achieving the SDGs, whereas the high-level political forum really allows us to get down into some of the details in terms of progress towards achieving those targets and goals.
Great, thanks. And I think what you mentioned, obviously, a logistical point, which is obviously really important, and many of the old-timers on the call will know this all very well, but the fact that if you're planning to attend a side event inside of the UN grounds, you obviously need to get a special pass from the organisers of the event. That's correct, Priya, right?
Yes, that is correct. So anything being held within the UN requires a special events pass. As we all know, there's a perimeter for security, and normal UN passes will not guarantee entrance. So you will be required to obtain a special pass through event organizers.
Great, thanks, Priya. We're going to move on to the next agenda item. Just a reminder to everyone, if you do have a question, you can type it into the chat facility on the online segment of the webinar. And also just another reminder that we'll be sending around the PowerPoint slides after the call for everyone to look through after the webinar as well. So our next agenda item is on the WHO Regional Committee meetings, which take place from September to November every year. So let me pass over to Jessica Beagley to give us an update on where we are with the RCMs.
Hi everybody, so first of all just a quick introduction to the regional committee meetings for people that aren't already aware. So essentially these are an important forum for member states at the regional level to discuss how to adapt global decisions and commitments to their own specific context. So it very much focuses on local context and implementation. In terms of what the NCD Alliance does around the regional committee meetings, we aim very much to coordinate representation across members and partners of the NCD Alliance to ensure that NCDs are well heard about at the meetings and aligned with our new focus on capacity development at the national and regional level. We've got a lot of representatives this year attending from national and regional NCD Alliances. We provide briefings tailored to each region, and we also draft statements that those delivering them can adapt for their own purposes. And then we monitor outcomes, and we'll provide a summary of outcomes from different meetings once they're all over in the middle of October. So just to skip through the dates of them very quickly, AFRO has already passed. That was the 19th to 23rd of August in Addis in Ethiopia, and we hope that we'll be hearing updates from Joseph Mucumbitsi shortly on what happened at that meeting. SEARO is currently ongoing in Colombo in Sri Lanka. And then forthcoming next week we have EURO in Copenhagen, PAHO in Washington, EMRO in Cairo, and last of all WIPRO in Manila in the Philippines from the 10th to the 14th of October. Joseph, I think, is having problems dialing in, so what I'll do is I'll skip through the next few slides and then we'll hear from Joseph momentarily. So in terms of what we've got coming up at SEARO, NCD Alliance is currently being represented by Radhika Srivastav of the Healthy India Alliance, courtesy of Alzheimer's Disease International. Thank you very much, ADI. And the World Heart Federation and the Framework Convention Alliance also have representatives that are present. We've just heard that the NCD agenda item that was due to be discussed today has been postponed until Friday. But at that point, a statement will be delivered by Radhika, and you can see the link for that at the bottom. Just a note to say that links will become active once the slides are posted online on the NCD Alliance website under Resources, but you won't be able to click on the links just yet. Two other agenda items. So SEARO is interestingly very focused on risk factors, which is fantastic. There's a resolution on the promotion of physical activity. The TIEs have been instrumental in building support for action on physical activity, which is often perceived as the forgotten NCD risk factor. And what we're hoping to see is that once SEARO adopts this resolution on physical activity, that it will then be promoted to the global level, and we'll see a global resolution on physical activity, most likely the year after the next WHA, which will be 2018. There's also a strategic plan being discussed to address what SEARO are calling the double burden of malnutrition, which we as the NCD Alliance refer to as malnutrition in all its forms, and this is all to do with the integration agenda of under and over nutrition. Very excitingly, The National NCD Alliance for Sri Lanka was launched at the very outset of the meeting, so this raises our total number of national NCD alliances to somewhere just above 50, I believe. And following SEARO, we've got EURO from the 12th to 15th of September in Copenhagen, and the NCD Alliance Network is very well represented there with the Union for International Cancer Control, the World Heart Federation, the World Stroke Organization, and the World Hospice and Palliative Care Alliance, all due to attend. There's a huge number of agenda items that are relevant to the NCD agenda coming up for discussion at EURO. So there's the agenda item that we always hope for but don't always see specifically on NCD prevention and control. Then also looking at NCDs in wider health and development agendas, so health in Agenda 2030 and also implementation of Health 2020, which is the Euro-specific regional plan. Strong focus on NCDs throughout the life course at EURO, including strategy on women's health and well-being and a strategy and action plan on healthy aging. Women's health and well-being being relevant because of the argument to include NCD prevention and control as integrated into the RMNCAH agenda, looking at opportunities to address NCDs in early life, but also specifically during pregnancy. And healthy aging because of the comorbidities that we often see for NCDs in later life. There'll also be a framework of action on integrated health services delivery, which is precisely about these two agenda items and others. Finally, some additional issues that will be discussed are a strategy and action plan for refugee and migrant health in the WHO European region, which the World Heart Federation will be making a statement on. Also the European environment and health process, and this will cover both air pollution and also exposure to harmful chemicals, among other issues. And for WHO reform, we'll be looking at the progress and implications for the European region. So with the framework for non-state actors just adopted, I'm sure this will crop up in conversations at regional level. Can I ask if Joseph is on the line?
Joseph, your line is open.
Joseph, are you there?
Okay, in that case, can we pass on? Okay, in that case, I think if we can't hear from Joseph, maybe it makes most sense if I go through the AFRO Regional Committee meeting just briefly, and just to say thank you very much to Joseph for providing the slides, and we're really sorry that we can't hear you at the moment, and we understand that you'll need to leave shortly. So on behalf of everybody on the call, thank you very much to Joseph for trying your hardest to participate. So the WHO AFRO regional meeting, excitingly there was an AFRO framework for NCDs is now being developed. So WHO AFRO is the last WHO region to adopt a regional NCD framework, and we'd hoped that it might be tabled this year, but it now looks like it will be discussed next year. So thank you to Joseph and others for their advocacy around that. So it looks likely it will be adopted at the 67th Regional Committee meeting in Zimbabwe, Victoria Falls, and we'll provide more updates on that when we get it. There was also an adopted regional oral health strategy within the wider context of non-communicable diseases, so great to see NCDs mentioned in that context, as well as an agenda item on Agenda 2030. So a little bit more information on that.
There was 3 main points in my slides, and during the regional meeting, the only agenda which were in line with NCDs. The first one was about the regional oral health strategy. That's my first slide, and in fact, I'll make it very short. Those were very complete statements which had been prepared in advance and read by the different delegates. So during the session itself, there was not much discussion about the different steps to be adopted. this is what I have been able to put together about the particular oral health strategy, which had to be discussed in the context of NCDs. And in fact, they adopted a lot of principles and measures in order to improve awareness, leadership, and multi-sector approach to reduce or protection on the risk factors. They insisted on collaboration between countries to develop infrastructure and health workers' capacity, because major weakness was that health workers didn't have enough knowledge and skills to deal with oral health problems. And they insisted also on the critical role of data, and they requested to continue supporting member states to advocate for health to the highest level and to provide guidelines, tools, and standards for the prevention and treatment of oral diseases. The other point was about the mobilization of resources. Next slide. Yes, thank you. So the other item, item number 16, after which we had to make our on behalf of NCD Alliance Global and East Africa, was about the implementation of SDGs in member states. They started with a report which identified key challenges to the achievement of the SDGs in countries, and which included fragmentation of the intervention, inadequate health financing, weak health systems, unequal access to effective services, and weak health security and ministerial responses. Then member states, they agreed that member states should strive to have one national plan, one coordination mechanism, and one monitoring and evaluation framework for implementing SDGs. Delegates insisted on the importance of sectoral actions to address social, environmental, and economic determinants of health and to reduce health inequity. With this, they added that we should have a healthy in all policies approach to development. They agreed that there should be long-term predictable and sustainable financing for SDGs achievement and for strengthening primary health care and health systems. They also requested WHO to support member states to generate and utilize resources for implementation of health-related SDGs and monitoring of progress towards the health targets. Next slide. Next, please.
I think that's all we've got for you, Joseph. I think that's all the slides we have. So there's... Okay, then the other one will not uploaded by the problem. Let me just one more slide. Let me read through. So it's about our statement during the so Mr. Wonde successfully made the statement on behalf of Global NCD Alliance, East African Alliance. But we did that after the delegates had finished the item. So we had no questions about our statement. That's why, and there was no comment. And even if I had asked delegates from Uganda and Rwanda to intervene on that, the main goal of our advocacy was to have the regional NCD framework on NCD to be put on the agenda of the next meeting, next regional meeting in 2017. When they brought the agenda, the draft agenda for next year, there was only items on NCD, hypertension in AFRO region, and COVID
and respiratory diseases. Fortunately, the Minister of Health intervened and asked to put the regional NCD framework on the agenda for next year for discussion. She was later seconded by Tanzania Ministry of Health, and who asked also specifically to add road traffic accidents on the agenda for next year. There were different interventions from different countries, and at the end, the chairperson proposed that all NCD topics be included in the NCD framework discussion, and they tasked the agenda committee, which usually in February, to put together the comprehensive agenda. Then after that, I had an individual discussion with Dr. Ali Salah, who is now in charge of NCDs at the regional office of WHO in Brazzaville, and he promised that the NCD framework should be on the agenda. But I would suggest that we remain vigilant and lobby with country members of the agenda committee to make sure that to be exactly put on the agenda. I suggest also that we should send a reminder to Dr. Moeti about our letter to the regional director, because we wrote to him a letter about this, and we should remind her about this, because I tried to talk to her, but she was not really remembering about that. So we should follow up on to make sure that these NCD framework should be on the discussion agenda next year. And the other point I would say is that there was also a presentation on the budget of WHO AFRO, where we discovered that NCDs had only $61 million US. And again, Uganda Minister of Health asked for it to be increased, but the answer of the finance director was that even if we increase that on our wish budget, we never get it funded. And it looks like everyone was agreeing with this. So fortunately, the regional director, Dr. Moeti, put it more nicely, suggesting that we could get funding for NCDs increased through the increase of primary health care and prevention activities funding. I don't know if you understand what that means, but that was likely compromise to have the budget for NCDs in the region in WHO AFRO increased. And they decided also about the next thing, which should be in Zimbabwe at Victoria Falls from August 28th to September 1st. Thank you.
Thank you very much, Joseph, for that great presentation. And it sounds like it was a major achievement to get the WHO AFRO regional NCD framework to be put on the agenda for 2017. So a major win for the East Africa NCD Alliance, I think, as a whole. We have one question that came in via the chat facility, which was around, so the question was around there is an NCD Alliance statement for the WHO European Regional Committee meeting, and can you please expand upon the content of that? So Jess, could you give us a few kind of key bullet points of what's in that statement?
Okay, so for the NCD Alliance statement, the 5 main points that I'll just skim through, there's also a link on the slides to the full statement. But the main points we're making are to develop and implement national NCD targets, and the WHO 2015 NCD Progress Monitor is really useful here because it tells us that only 23% of countries in the European region have set national NCD targets and indicators, despite committing to do so in the 2014 UN review on NCDs. Second point is to accelerate progress on risk factor prevention. Third is to enforce a health in all policies approach. Fourth is to increase the provision of adequate and sustained domestic and international resources. And fifth is to strengthen consultation with and collaboration with civil society. And linked to that, you'll be hearing from Cristina a bit later on some of our regional committee meetings, and there is one we hope to be held in Euro in the coming 12 months at a date to be confirmed. So all of that being said, if there are no other questions.
Thanks, Jess. And thank you again, Joseph, for joining and for presenting on the WHO AFRO Regional Committee meeting. Apologies for the slight difficulty with the line there. Thank you, Joseph. Okay, let's move on to our next agenda item, which is we're going back to the global level to WHO for an update on where we are with the global coordination mechanism. And let me pass over to Terrell Carter, who will be presenting on the two working groups that have been underway for the GCM. Over to you, Terrell.
Thanks, Katie. Hello, everyone. As Katie mentioned earlier, I'm presenting on behalf of Dr. Jonathan Klein from the American Academy of Pediatrics and NCD Child to give you an update on the GCM, specifically working groups 3.1 and 3.2. So although I may not be able to answer all of your specific questions, if I can't, then I'll make sure that Dr. Klein gets that question and gets back in touch with you if there's any concern there. So moving to the next slide, just we're all familiar with the Global Action Plan on NCDs and the 4 diseases and 4 risk factors. I won't go into that. Moving to the next slide, I believe we're also all familiar with what the GCM for NCDs is, and the scope and purpose of the GCM really is to facilitate across sectors and at all levels to contribute to the WHO NCD plan there. We can actually skip on to the next slide. I'm going to kind of flip through a few of these that we don't need to go into detail to, but the 5 functions of the GCM you'll see outlined in that next slide. And moving on again through the next slide on the different activities of the GCM, which really focus on working groups, which I'll be talking about today, exchanges of best practices, webinars, communities of practice, and of course the Global Communications Campaign, which recently launched. So next slide on the WHO GCM, the purpose of the working groups. So these working groups are really built to provide recommendations to the WHO Director General and as a focus on encouraging countries to realize their commitments made at the 2011 UNGA high-level meeting and through the UNGA outcome document 2014. And so if we go to the next slide here is where you can see over the past 2 years there's been a lot of activity around the working groups. And the working groups have really allowed the WHA to identify priorities. And today, as I mentioned, I'll specifically talk about Working Group 3.1 and 3.2, which are 2 in a series that are addressing the importance of country guidance and country engagement. It has really been a focal point for 2016 and 2017. So the next slide, just now we're going to focus on Working Group 3.1, which has really focused on the inclusion of NCDs and other program areas, which we know is such an important topic to discuss and make sure happens right now with integration at the global level and down through all other levels. Briefly, the next slide gives you an overview of the members of Working Group 3.1, which is made up of 12 different members and 2 co-chairs from all over the globe. And then the next slide after that gives you an overview of the meeting schedule for Work Group 3.1. You can see there have been 2 meetings so far. After the first meeting, there was identified additional information around the integration of NCDs and other programmatic areas, and some interim guidance was established. And at the second meeting this past June, there was a discussion and a hearing with stakeholders and experts to get feedback and feedback on draft recommendations. And after that meeting, we published an interim report with draft recommendations for public comments, which I'll talk a little bit more about. But the next slide there just shows you during that stakeholder hearing at the second meeting, the stakeholders that were represented. You can see there were many, many different stakeholders, probably some of you on the line today that gave testimony and gave great guidance to the GCM on those draft recommendations. So the next slide then, just kind of focusing in on the published interim report with draft recommendations for public comments. That's where we are at right now and what stage we're in. And the GCM is looking for comments from everyone on the web through a web consultation. So if we go to that next slide there, we're going to talk specifically about the web consultation on the interim report. The final report after this interim report will include recommendations and inputs from the stakeholder hearings and from the web consultation. So it's really important, and we really hope that all different groups provide feedback. The main purpose of the consultation is to seek guidance on the draft recommendations and also to learn how the recommendations can be most useful, and also get comments on the overarching principles, and hear from all of you in terms of country cases, best practices, and evidence on integration efforts that have worked and why not. So if we go to the next slide, this next series of slides really looks at what's up for comment. It's just bullet points on what you'll see when you see the interim report. So I won't read through them in detail, but just to give you an idea of what's in the interim report, and again to encourage you all to go and review and submit your comments there. So this concept of integration is one that the GCM is really looking for feedback on, where we define integration on people-centered health services, and that noting that integration requires resources, including people, and that ideally its integration of care is complementary to vertical or categorical condition systems, and a focus that downstream and upstream integration is needed. So after looking at that concept of integration, if you go to the next slide, there is a focus on 4 different overarching principles that the GCM is hoping to have feedback on as part of the interim report. The 4 principles, 2 are outlined on this slide, where it looks at the national NCD responses should focus on people, families, and communities with a life course approach and a population-based healthcare delivery strategy. And then the second overarching principle, strong and sustained high-level political commitment is needed to drive cross-sectoral integrated NCD-specific and sector-wide approaches. And within those principles are different notes there that are outlined more in the interim report. The next slide, looking at the last 2 overarching principles, where implement responses for the prevention and control of NCDs based on human rights and equity-based approaches and poverty reduction strategies. So hoping that these principles and approaches are relevant for all countries and focus on the vulnerable populations there. And the last overarching principle of the report, involvement, engagement, and empowerment of civil society is essential in formulating and implementing policy decisions. So moving on to the next slide and looking at, there's 9 recommendations outlined in the interim report. The first 3 are on this slide that focus on, again, the support of an integrated people-centered healthcare and population-based strategies, and what that would look like in health systems. And second, policymakers require context-specific evidence, best practices, and business cases for effective integration. So really making sure we have an evidence base for interventions that we're implementing and how they support the integration and prioritization of NCDs in other program areas. A third recommendation that focuses on governments requiring focused support from international development partners and intergovernmental organizations for effectively implementing the integration of the prevention and control of NCDs within other program areas. The next slide, the fourth recommendation, is focused on enhanced government commitment and how it is required for building adequate and sustainable health workforce to manage and integrate NCDs. So part of the report really does put a focus on management and how we manage this at the government level, these recommendations. A fifth recommendation, governments need to ensure the promotion, development, and implementation of the high-level multi-sectoral mechanism or commission on NCDs with clear leadership from the health sector. And a sixth recommendation for governments to ensure that quality NCD services are incorporated and integrated in primary health care and that quality and timely referral systems are functional. In the next slide, looking at another recommendation on delivery, that service delivery levels should be comprehensive and horizontal, but it might require starting from the successes of integrating with vertical programs such as HIV or TB. A next recommendation on the effective integration of NCDs within other program areas and how that may require task shifting or task sharing, and utilizing the available human resources in the most efficient way through the task shifting and task sharing. And then the final recommendation in the report is around governments investing in research and implementation of innovative technologies, which is a focus on e-health and m-health, and how these can support integration and scale up and outreach of NCD strategies and programs. So then the next slide gives you an overview of some of the additional sections in the interim report. There's 3 tables that we're looking for feedback on, and you can see them outlined here on this slide around key principles for successful health systems integration, potential efficiency gains from integration and potential challenges for integration of NCDs, and possible actions to overcome them. And then another tool that we're really looking for feedback on is the log frame tool, which if you go to the next slide, shows you sort of what that looks like. And this is really a mapping tool looking at entry points for planning and assessment of integration across program areas and within the primary care and universal health care. So you'll see that matrix on the next slide. My slides are a little bit delayed, so hopefully you're seeing that matrix right now. But just an overview, you'll see it in the interim report too. So then if we move on to the next slide after the matrix, where just some main points here around comments are due to GCM by September 16th, so not too far away. Again, they're really looking for good parts to keep and what parts to emphasize, so which recommendations which should be emphasized, which parts to keep, not just looking for critiques. We're really wanting input there. And comments are also invited on Working Group 3.2, on the alignment of international cooperation on NCDs with national NCD plans. So it's taking it more to the national NCD plan level, and I won't review that in detail today, but the slides are as an FYI. And then you can see here just on behalf of NCD Child and AAP, we have a global comment that both reports could use more specific mention of children and youth as special and vulnerable populations with opportunities to benefit from integration and population health, universal health care, thus changing life trajectories and strengthening communities and families. And we will be issuing and reviewing the interim report to include more, hopefully include more comments around youth and children. So the next slide there, again, Working Group 3.2 focuses on the alignment of international cooperation with national plans on NCDs. And there is a very similar timeline and events for Workgroup as Workgroup 3.1. If we go to the next slide, you'll see the 12 members and 2 co-chairs for Workgroup 3.2. And the next slide after that, again, there was a stakeholder hearing very similar to Working Group 3.1, where stakeholders gave input on draft recommendations that had been discussed at the working group level. You can see those participating organizations in that slide. And then going on the final few slides here that outline the 8 different recommendations in the interim report for Workgroup 3.2 that focus on, I won't go through them or read them out in detail, but you can see them here. And again, the GCM is looking for comment on those also. So the first 4 here are reflected on this slide, and then the next slide you can see outlines the final 4 recommendations in that interim report too. So with that, again, thank you very much for the opportunity to be on the webinar and give you this update. The GCM is doing some really important work through the working groups and really working to coordinate and collaborate to ensure that all agencies and levels are working together, and AAP and NC Child are very happy to be a part of that. So again, I just encourage you to you yourself and your organizations to provide comments through the public consultation up to September 16th, and I believe that's all. Thank you, Katie.
Thanks very much, Terrell, for that presentation. I don't think we've had any questions in. Let me just ask a couple on my side. I think these working group reports are really useful, obviously very quite dense, some of them I would say, just from past experience of the previous working groups, not talking about these ones anyway. I'm just wondering, in terms of the recommendations, there's obviously a lot of recommendations in them at the moment. Do you think there's a plan to kind of slightly reduce the number of recommendations or consolidate them a little bit?
So I think that there definitely is opportunity to shape and focus them, and then that's one thing that the GCM is really looking for feedback on through the web consultation is how can we shape them and focus them a little bit more, and really focusing on choosing those that address management, financing, evidence, data, services, and delivery gaps. So, they really welcome critiques on the draft recommendations, but also need guidance on how to focus them. So I think, in a sense, yes.
Okay, great, thanks. So just to reiterate, a real encouragement to others to be reviewing those reports and to be providing comments via the web consultation on the GCM website. Thanks very much, Terrell, for joining us.
Thank you.
Okay, so let's move on to our next agenda item, which is 2 updates on the regional side of things. So I'm going to hand over to Cristina Parsons Perez, who's the NCD Alliance's Capacity Development Director, to talk us through a recent EMRO Capacity Development Workshop that was held in Jordan, as well as an Africa NCD Civil Society meeting that's coming up in Mauritius in October. Over to you, Cristina.
Thank you, Katie, and hello, everyone. I would just like to start off by saying that both the capacity development workshop that just happened in this August, as well as the work that we are planning with WHO AFRO for the African region, both concern supporting and nurturing national and regional NCD alliances and really encouraging the creation of an NCD movement to lead to national action and to accelerate progress. This is something that has been embedded in the NCD Alliance's strategic plan for the next 5 years and that we are very excited about. I will start off by giving a little bit of context. You may recall that last year the NCD Alliance held a series of regional civil society meetings, some of which in collaboration with WHO regional offices. We held one in collaboration with WHO EMRO, and this was the Eastern Mediterranean Region Civil Society meeting that took place in Cairo in September. This meeting was attended by 45 participants working on the different NCDs, as well as organizations that were working on consumer protection, children's health, health policy reform, and so on. To inform that regional meeting in 2015, the NCD Alliance conducted a mapping exercise of civil society in the Eastern Mediterranean region. And this was to give us a snapshot of the current activity, current capacity, some of the gaps existing, and to really inform this meeting as well as the work overall of the NCD Alliance and other organizations such as WHO EMRO itself. Now, emerging from this regional meeting, as well as that mapping that we conducted, were a series of recommendations, and these identified the need for increased regional coordination of civil society and NCDs, the need for capacity building of civil society organizations in working in this area, the importance of sharing good practice across organizations, and improving advocacy skills of civil society organizations. Next slide, please. And in response to these recommendations to really strengthen civil society so that they can support and be an active partner in implementing something like the Eastern Mediterranean region regional framework on NCDs that exists and that was put together by WHO EMRO and supported by its different member states. In order to really have this vibrant civil society in the region, WHO EMRO and the NCD Alliance collaborated on a capacity development workshop that just occurred over this August in Amman, Jordan. Now, the objectives of this workshop was to respond to those recommendations, to increase the ability of civil society in the region to form effective NCD alliances, to increase advocacy skills, and also to provide an environment that was conducive towards nurturing this idea of increasing regional coordination across the different organizations. If I may recall, this is a region where we have NCD alliances in Egypt, Saudi Arabia, Syria, and in Lebanon is just being established. Next slide, please. So this workshop was attended by 28 participants from 10 different countries. We had the chance of actually piloting training materials that the NCD Alliance has developed as part of its capacity development strategy. And so we worked on building an effective NCD Alliance, strategic advocacy planning, and also facilitating those discussions around enhancing regional coordination. I would also like to point out that at this particular workshop, the NCD Alliance held a pre-dialogue caucus on contributions of the civil society as part of Agenda 2030. And the idea is that these pre-dialogue caucuses are occurring throughout the year with the view of feeding into the global dialogue occurring this October as organized by the WHO Global Coordination Mechanism. Next slide, please. Now, the outcomes of this specific workshop were that we now have some concrete discussions around the forming of a regional NCD alliance, so really identifying how to best coordinate, how civil society organizations can best coordinate. We have heard that a Jordan NCD alliance is forming. The discussions from the pre-dialogue caucus on the roles of civil society, which of course reflect some of the idiosyncrasies of the Eastern Mediterranean region, but we feel have some very interesting points applicable to civil society working in NCDs globally. These will be put together in a report to feed into that global dialogue, as we were saying, being organized by the WHO Global Coordination Mechanism later this year. And this will be shared with our network, of course. And in addition, we produced a handbook of Eastern Mediterranean civil society case studies in NCDs, and this to us is very interesting. We know that there are NCD networks out there and organizations working actively on NCDs, and we have heard very loud and clear that disseminating knowledge of what is happening and what different organizations are doing is particularly useful. So we have collated different case studies and attempted to dissect some kind of critical factors for success, and this handbook will be disseminated over the next couple of weeks or so, and we will be disseminating this with the NCD Alliance network. Next slide, please. If I may move on now to the work underway on a regional civil society meeting for the African region this time. And this is a collaboration between WHO AFRO and NCD Alliance. I believe earlier in the webinar you heard mentioned that the African region is the only region of the WHO that is lacking a regional plan on NCDs. Many of our civil society partners have been advocating for the creation of such a plan, and we are delighted to be organizing this meeting in collaboration with WHO AFRO, and this links to a regional NCD action plan, and I will clarify that in one moment. So this meeting is being called a Regional Civil Society Organization Consultation. It is aimed to take place this October 17th and 18th in Mauritius with approximately 50 participants by invitation only, and the invites should be sent in the next week or so, and the idea is that the meeting will be attended by a cross-section of individuals from across the different African subregions, and also representing organizations working on the different diseases as well as the different risk factors. It will be followed by the global dialogue occurring on the 19th and 21st of October. And again, the focus of this global dialogue is on the role of non-state actors in supporting NCDs as part of Agenda 2030. The objectives of this regional civil society meeting are to bring together civil society from across the region for the first time, and we are particularly interested in the aspect that this meeting will serve as a consultation. So this is where WHO AFRO will be sharing their draft regional framework on NCDs, the one that we and the community have been advocating for. We understand there's a draft regional framework on NCDs, and that will be actively consulted with civil society in attendance at this meeting. We heard from Joseph Mucumbitsi earlier on that the adoption of this regional plan is tabled for the regional committee meeting of WHO AFRO for 2017. Finally, the other objective for this meeting is again to discuss a regional coordination amongst civil society in the region. Next slide, please. And finally, as for other regional meetings, the NCD Alliance will be conducting a mapping exercise of civil society, providing a snapshot of what is happening in this region, what are some of the main areas of action, challenges, gaps, and opportunities. The methodology used is one of survey followed by interviews. If you are interested, please reach out to us at the NCD Alliance. If you have knowledge or contacts of civil society organizations working on NCDs in the African region, we're building up this database of contacts to share this survey. And thank you.
Thanks very much, Cristina, for those updates on the EMRO workshop from Oman just in August, and then the Afro Civil Society meeting coming up in October. We're really looking forward to the Afro Civil Society meeting. I think it's going to be a great opportunity to convene all of the Africa NCD civil society organisations and to build momentum in a region where we have got a significant number of national NCD alliances, which is fantastic. Okay, so in the interest of time, we're going to jump to the next agenda item, which is we're going back to WHO Geneva for an update on where we are with Appendix 3 of the WHO Global NCD Action Plan. So Alena, Matzke from Geneva, over to you.
Thank you, Katie. Next slide, please. Great. So I'm going to provide a very brief update on the review process of the WHO Global Action Plan Appendix 3. So just as a reminder to everyone, Appendix 3 is a menu of policy options for each of the 6 objectives of the Global NCD Action Plan, and this appendix includes 14 interventions that have been classified as very cost-effective and affordable for all countries. When the Global Action Plan was adopted in 2013, it was agreed that Appendix 3 would be updated as evidence and cost-effectiveness of interventions evolved with time. And so member states, or the WHO, has been conducting this review and this updating process of Appendix.
Alena, sorry to interrupt. Could you just speak up a little bit because your line is very quiet?
Oh, I'm sorry.
Thank you.
So yes, I'm just going to repeat. So when the Global Action Plan was adopted in 2013, it was agreed that Appendix 3 would be updated as evidence and cost-effectiveness of interventions evolved with time, and also to take into account new WHO recommendations that have been agreed since the adoption of the plan, as well as to refine existing interventions. In terms of the timeline, expert consultations were conducted in 2015 to advise on the methodology and timeline for review, and then in 2016, in June this year, a second expert consultation was held to review the updated economic analysis that had been produced, and also to advise on the presentation of the interventions in the updated Appendix 3. In August, so just last month, the WHO conducted consultations with both member states and then also with non-state actors, and there was an online consultation on a WHO discussion paper that had been published this summer. This consultation ended on 1st of September, and now the Secretariat is reviewing the input received both at the in-person consultations and through the online consultation process, and the updated Appendix 3 will be prepared for review by the Executive Board, and then is expected to be adopted at the WHA next year in May. Also, just to say that since, of course, this current Global Action Plan runs until 2020, any future updates of Appendix 3 will be considered as part of the development of subsequent global NCD plans and strategies. And for more information on this process, there's a link included on the slide here that you will be able to access once these slides will go online after the webinar. Next slide, please. Great. So I've here included a snapshot that I'm going to briefly go over of the methodology that was endorsed at the WHA for the updating of Appendix 3. So just to give you an idea of how interventions were identified for consideration in this process. All of the interventions in the initial appendix were reanalyzed, which actually meant that some interventions were also taken out. So it wasn't just about adding, but really about reviewing what was there. WHO technical units were asked to specify any additional interventions for which new guidance had emerged, and the WHO expert meetings on both the risk factor side and the health system side were invited to submit any additional interventions that they thought should be considered using a template provided by the WHO. Now, these interventions were analyzed using, were analyzed according to cost-effectiveness data available using the WHO choice method, where enough data was available for analysis, the size of health gain, budget implications, and then also implementation considerations such as qualitative analysis to consider feasibility, acceptability, equity, etc. Next slide, please. All right, so what has changed so far? As the recommendations under objectives 1, 2, 5, and 6 of the Global NCD Action Plan are mostly process-related, these haven't changed as WHO didn't think that these had to be changed as they're not based on cost-effectiveness consideration. We have a slightly different take on this, and in our consultation response actually did propose that some changes should be made to these objectives. The part of the Appendix 3 that's really changed is around Objective 3, which is on risk factor interventions, and then 4, which concerns health systems. So under we've seen a slight increase in interventions. However, the ones that are bolded, so the ones that are identified as the most cost-effective, have stayed the same. Under each objective, there's now a list of overarching and enabling actions that are more general, and those are separate from specific interventions considered cost-effective or very cost-effective. And this differs from the previous Appendix 3, where general and specific interventions were listed together. There's also non-financial considerations that have been added to the current Appendix 3. Under the section risk factors, we have seen a disaggregation of unhealthy diet and physical activity interventions, which we strongly welcome, and we've seen quite a few additions specifically on unhealthy diets, on how to address unhealthy diets. Then there's also new interventions that have been added across Objective 4, which concern interventions on the different NCDs, including an addition of basic palliative care package for cancer, which is great. And then there's a technical appendix that will accompany this updated Appendix 3, as well as a proposal of an interactive web tool to provide nationally adapted information. Next slide, please. Finally, to finish or to close my presentation, just a few points that we highlighted in our rather lengthy submission of 11 pages. I think in general, it's fair to say that this updating process has sparked really important discussions on the availability of cost-effectiveness data, on the gaps in cost-effectiveness data, and really led to an increased engagement with WHO technical leads on the different diseases and risk factors. In general, the NCD Alliance welcomes the breadth of the new additions. We're quite happy to see a lot of new additions. We also very much appreciate the separation of non-specific interventions, so these overarching or enabling interventions, and from the specific interventions, and the addition of non-financial considerations, which we deem quite important, however wish to see elaborated on, further articulated. We strongly support the proposal for an interactive web tool to accompany this updated Appendix 3, and recommend that this tool includes a specific call for research in key areas to address current gaps in cost-effectiveness data. We consider this a very, very important piece, and so far understand that it has been resonating with WHO. We also recommend that further iterations of this appendix really expand the scope of Appendix 3 beyond the 4 main NCDs, and we would like to see a much greater emphasis on the limitation also of cost-effectiveness analysis and the need to take into account additional parameters when prioritizing interventions. This, in our opinion, has to be highlighted a bit more prominently in the updated Appendix 3. And then we also pointed out something that I think is quite important, which is that the current model fails to count the need for broader health systems investments, which are essential to underpin the list of proposed interventions. And at the bottom of the slide, there's a link to our detailed submission, which includes a lot of detail on the specific sections of the updated Appendix 3. This is it from me, Katie. Thank you very much.
Thanks, Alena, for that update. I don't believe we've had any questions in. As always, I've got a couple up my sleeve for you. Number one is, so you were obviously at the recent NGO stakeholder consultation on Appendix 3 in Geneva just last month. And obviously this is the first time that they have reviewed Appendix 3, so this whole process, the methodology, everything that's happening is all new to us all. What was the kind of general feeling around the room in that consultation about how this process is being run?
I think there's some general appreciation for the work of the WHO. The WHO team working on this piece has very limited capacity. They're in fact still doing some additional analysis. From what I could tell, I think people seem quite happy with this process, but there is definitely a lot of need for further research, and there's definitely like major gaps on cost effectiveness data, which then kind of leads to a bit of a skewed picture really for some, especially for some of the risk factors such as physical activity, but also on unhealthy diets. So a lot of need for research in the coming years. So I think this process has been very useful. It's kind of to allow everyone to come together and kind of review where we're at. But between now and the development of the next Global NCD Action Plan, in my opinion, a lot has to happen, and I think that was sort of reflected by a lot of the interventions in the room as well.
Okay, thanks. And just a second question. So you said that it's obviously going to be going to the Executive Board in January. Does that mean that we're not going to get sight of a second iteration that we'll be able to comment on? Was that the last opportunity, basically?
Yes, and even in this consultation, the WHO was much more interested in input on the presentation of the appendix. So there was obviously opportunity to comment on the different interventions and opportunity to provide additional evidence, etc., where available. But I think given the tight timeline around this, the focus is really more around the presentation of this updated version, and unless I'm completely mistaken, but I'm fairly certain there's no more opportunity for input. It's going straight to the EP for member states to discuss and then into the WHA in May.
Okay, thanks very much, Alena. And that brings us to the end of our webinar. So thank you very much to all of our speakers, and obviously particularly our guest speakers, Joseph and Terrell, for joining us today. As I said earlier, we'll be sending around the PowerPoint slides. They'll be available on our website to download as always. And I expect we'll be holding our next webinar sometime at the beginning of October. So after the UN General Assembly has happened, we'll be able to update you on everything that took place in New York, as well as many other items. So thanks, everyone. Bye.